Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Welcome to Your World Today. My name is Ofelia de la Torre.
And I'm Carignane von Pohle.
So we had Dr. Trenkle at our studios in Torrance, and now we're here at his office at White Memorial Medical Center. Welcome to the show again, Doctor.
Thank you.
We're so excited to visit with you again. And
right.
In your digs this time.
Glad to have you visiting me.
So, Doctor, we're talking about men's health.
Mm-hmm.
So we want to know how a doctor in your specialty can help us, help the men out there that are watching to have a healthier life and preventable disease.
Absolutely. In our specialty, we obviously are the otolaryngologists, ear, nose, and throat physicians.
Did you see how
didn't say it. We made you say it.
That's always a smart idea. Yeah, it took me about 5 years to learn how to say that too.
That's a tough one.
So we have a lot of different ways to help young men and women, but specifically young men today, to help for screening process as well as treatment of any diseases. I see a lot of young men in my clinic here for different problems. One of them being sinus analogy, which we spoke about quite a bit at length last year, but in general, we see a lot of that, especially in urban areas. It happens suburban as well, but urban areas such as Los Angeles, where there's a lot of crowding, a lot of people, and people are allergic to all sorts of different things. This can cause all sorts of problems with the nose, with congestion, with breathing, with sneezing. And while these may not always lead to life-threatening illnesses, they can lead to things such as asthma, which obviously can affect them from a life and death standpoint.
Sure, impact in your life.
Yeah, absolutely. And allergies obviously affect a lot of people. And adults specifically tend to have a lot of allergies which we don't catch until later on. Obviously, they're adults. In people with very severe allergies, we catch it very young when they're kids, and most of the time they get onto treatment, and those are the ones that tend to develop asthma, etc. But young men tend to also develop a small amount of allergies, which can lead to a buildup of symptoms over time, especially with a combination of other nasal defects such as septal deviations, which can cause a big trouble breathing. We see that mostly in young men because boys tend to run into things, get in fights, get hit with soccer balls, whatever it is, and it causes a deviation of the septum, which is the cartilage that separates the two sides of the nostril. A lot of people suffer from this, and not all of them even understand that it's something that can affect their life in any way.
So you're talking young men. How young are some of your patients that come in here?
As young as even 15,
okay.
But I see a lot of patients in their mid to late 20s and early 30s because, as everyone knows, as we start to age, things start to affect us more. Just like when you twist your ankle when you're 5, you bounce back within a day. You twist your ankle now when you're 33. 28, you tend to take a lot longer bouncing back from that. Same happens with our nose, with everything else. As we're aging, we try and breathe through our nose, and now that small septal deflection or deviation where we can't breathe through the right side versus the allergies and the additional effect of all the allergies over time makes it really hard to breathe.
Well, that brings me to a whole bunch of questions, Doctor. I see people that are just breathing normally, and I can hear their breath.
Yeah.
Every breath they take, it's like, also a lot of people snore, women and kids.
Mm-hmm.
And these symptoms, do they also take you to asthma?
Those generally don't lead to asthma. The ones that are tied to asthma are more the allergies and eczema, like skin conditions. Those three conditions we tend to link together. Snoring, however, does have a big social impact. It can have life-threatening impacts when we lead it all the way to obstructive sleep apnea. However, the snoring impact is more socially unacceptable for people with spouses, etc. And I do get a lot of patients with that.
Oh, yes.
And that happens frequently from a bad septal deviation and also from the nasal congestion caused by the different things we're talking about.
What are some of the things that you'll see with some of your older patients, older men? What do they experience when they come in here?
From the same problems when we're talking kind
Snoring,
of...
of
yeah,
course.
yeah. Generally speaking, it's very similar to the younger, but some people, they just put it off till longer. So I get a lot of patients who come in thinking they have very little symptoms, and if they do end up having a surgery or medicine to fix it, they always tell me afterwards, I can't believe I was breathing with that problem for so many years, you know.
So I know that a lot of people deal with allergies that don't let you breathe very well, that create mucus, or you have a bunch of like headaches or wheezing or whatever. People live with these conditions. I mean, why is it that we don't think that coming to a doctor with your specialty will cure you? I mean, they go on and on for years, with especially young guys, I think.
Yeah. No, that's, again, it's very common, and I think it's, you know, a lot of it has to do with people's affinities even going to a physician in the first place. Most people don't like the idea of going to a doctor, and they all think, and sometimes it's true, that if they come to a doctor, you know, they're going to find something wrong.
So these guys, let's say postnasal drip or sinus issues, and if you don't treat it, what can happen?
Like I said, it's not always something life-threatening. One thing I love about my specialty in general is I don't deal with as much life-threatening as I do quality of life. Quality of life tends to be a lot more rewarding for me as a physician to treat, because people come because they want to be here. So what it usually leads to is a lot of problems socially, you know, whether it be from, you know, constantly coughing, hacking, spitting up, you know, kind of a lot of drainage, sometimes halitosis or bad breath, you know, just constant runny nose, needing a tissue, etc. And just in general, just the difficulty in breathing over time, it gets usually kind of comes to a point where someone says, all right, this enough is enough.
That's it, okay.
And now you also deal with things that can get more severe. So what are some of the issues, you know, that you see that can be life-threatening here?
Yeah, absolutely. I mean, from a sinus or from a snoring kind of standpoint, I do deal with some sleep apnea, which is more of a lung doctor's field in general to treat. But when it's no longer being treated well by the CPAP machines, etc. I do certain sleep apnea surgeries to kind of help open things up, help decrease the snoring, help the CPAP machine work well. Also, I do deal with a couple of things that overlap with some of the stomach doctors who I know you're probably visiting, such as acid reflux. It oftentimes does get into the voice box, and that causes a lot more symptoms than it would, let's say, cancer or something. And lastly, I do deal with a lot of head and neck cancer, which is oftentimes the cause of smoking mainly.
Right,
you know.
right. So, doctor, when we find people spitting, and it's really gross, especially guys. I mean, I don't see women doing it a lot. When they're spitting and they're clearing their throat and they're spitting, I see that a lot. Is that a certain condition? I know we can continue talking about this. We have to go to a break, but when we come back, we'll pick it up there.
Sounds good.
Okay.
Hi, welcome back. This is Your World Today. We're continuing our conversation with Dr. Trenkle about sinus and breathing health and all sorts of issues that it can affect men.
And grow. I know he told me off camera that we create about 2 liters of mucus.
1 to 2
no,
liters.
we swallow.
Yeah. We swallow about 1 to 2 liters of mucus a day. Yeah.
Whew.
I don't
No wonder we're hungry at
I don't
all,
want to
man.
swallow that.
That's why people don't come to doctors. They don't want this knowledge.
Right. That's
Ignorance
gross.
is bliss,
That's
right?
right. Exactly.
So we swallow a lot of mucus. So we see people clearing their voices, their throat a lot.
Yeah.
What is that a condition? Is that?
Yeah, it could be any number. What we think of that as more what we call a symptom. So a symptom is something that tells us that there could be something else, and it could be multiple different things. It can be something as simple as acid reflux causing irritation. Here it can be simple as allergies kind of draining the back of the nose to the throat. And it can be something as serious as cancer in the voice box or somewhere else in the head and neck is what we kind of refer to it as.
So, doctor, you mentioned that cancer is one of the big risks.
So we're in one of the examining rooms in Dr. Trenkle's clinic, and you're ready to do perform a procedure on my friend Carignane here.
And I think I'm ready too.
And he's not nervous at all. He's very, very much looking forward to it. Doctor, what are you going to do?
All right, don't worry, it's very normal to be nervous. Most of my patients are nervous before we do it, and none of them are usually nervous afterwards.
We can hold your hand,
Yeah.
too.
The
I
first,
see a syringe. It makes me a little nervous.
don't worry, there's no needle involved.
good,
What this is a mixture of lidocaine and Afrin, a common nasal spray people use for decongestion. I'm going to use that to do a little bit of numbing on you. It's probably going to make you do a little bit of coughing and maybe a little bit of gag, but not too much, okay? So let's start with this. All right, just kind of head back for me. So not great tasting, but not terrible.
Not the best flavor I've ever had, but
Yeah, we need to infuse some cherry into
that's
it.
doable. Yeah.
You okay?
Yeah, that's doable.
Okay,
Okay.
all right.
Yeah.
So now we basically wait for a few minutes and we let that kind of numb your nose and the back of your throat. Afterwards, we'll take this tiny little spaghetti strap and we'll put it right into your nose.
Woohoo!
Here we go. The fun's just beginning, I guess.
How long before it gets numb?
It usually only takes about 30 seconds to a minute. Sometimes I'll leave my patients numbing for as long as 10 or 15 just to ensure that we get a very good result and that essentially you're not moving so we can visualize everything well. So basically once we've waited and gotten you nice and numb, the next step is obviously to get our camera set up and defog it and place a little lubrication for your comfort. The next step that we're going to do here is I'm going to place you in what we call the sniffing position. The sniffing position is for me so that when I'm back there I have the best position possible. So what you're going to do is keep your butt all the way back. Okay. You're going to lean yourself forward with your hands. Yep, that's good, just like that. Your chin up, exactly.
And am I in this position the whole procedure?
The whole procedure. Okay. And then all you're going to do from here on out is kind of follow my instructions. I'll give you basic instructions. Say E, say oo. May have you sing for us. We'll see how things are going. And then what I do is
tune.
Exactly is record this so that we can kind of watch it afterwards.
Okay.
So we're going to get to know Carignane a little bit better.
So here we are on the inside of the nose. And that right there is a big septal deviation and spur that we were just talking about. So that was perfect. I'm going to dive underneath. This part's the most uncomfortable. I'm sorry. It's a little bit of pressure.
It was worth it to volunteer, Carignane.
Exactly. So now we're kind of diving the back of the throat. And there's the back of the tongue and the epiglottis. I'm going to get you to lean forward just a touch more if you can. Perfect. Now, if you can, just hold out a nice, gentle E for me. E. Fantastic. Now, a little bit longer and higher. E. Great. Now, if you can, go from low to high. E. And then back down low. Those are the vocal cords there. Perfect.
I'm not used to singing with something in my nose. I'll be
now,
honest with you.
Sing us a tune. Let's see if you can how well you can sing. Can you
Boy,
think
putting
of
me
one?
on the spot.
Yeah.
Amazing grace, how sweet the sound. Yeah, that's all I got.
It sounds very nasal.
It does.
That is plenty. You're doing fantastic.
My dad, the voice teacher, is going to have to critique that.
Perfect. Okay. Well, that's pretty much it. We've gotten a pretty good look. What we're looking at here is the vocal cords. Those go right down into the trachea, which goes into the lungs. Then we have all the things protecting the voice box. And then the back, right back here, would be the esophagus. That's where the acid would come up and cause a lot of issues. This is how we evaluate to look around in all the different subsites for cancer. And we can also check for nodules and any singers. And I can have you do these different voice exercises to really get a good look. I can also put a video stroboscopy on this, which is a strobe light, which really slows down the motion of the vocal cords and allows us to see how well they're coming together and what exactly is wrong and what's causing any voice disturbances. So now that I've done all that with this near nose, I'll take it out for you.
I know you're not a happy camper, but this is amazing
Whew.
stuff.
All right.
You should see your inside.
It's all for education. And I think I'm crying a little bit. Yeah, no, we're good. We're good. I'll survive.
I'll tell you something. You're as beautiful inside as you are outside.
That's very sweet of you to say.
Tell us about your experience. How was it?
It wasn't too bad. After they numbed it, or after you numbed it, I really couldn't feel very much. When I swallowed a little bit, I could tell that there was something in there that's not normally in there, but otherwise it wasn't terribly uncomfortable. And what's my bill of health? How'd I do?
Yes,
You did fantastic. The only thing that we really saw was what we were talking about, which is funny, but it's a septal deviation kind of off to the right. It may not be causing any problems, but that's exactly what we talked about. Some people it does, some people it doesn't. Sometimes it builds up over time. Essentially, on your right-hand side, you have a little bit of bone kind of sticking out and causing an obstruction.
Okay.
So Nothing that's going to cause any problems long term, but can be uncomfortable.
Wow. Well, what an experience. Thank you, Carignane, for being so courageous.
And we can show people that it's easy and it's not
Yeah,
painful.
it's not that bad, huh?
Yeah.
Okay, well,
Definitely.
I'll come and see you, Doctor.
Yeah.
Next.
Well, thank you
Dr.
very much
Trenkle.
for being a guinea pig.
Anytime.
Thank you.
Anytime.
Thank you, Doctor. Well, that's it. We have to go, but we know a lot more now about
We do. I know a lot more about myself. for
yourself
sure.
and this issue. So thanks for watching.
We'll see you next time.